Kia ora koutou. Thank you so much for having me, even if virtually. I come to you from my bedroom here in Singapore, but I'm very much looking forward to, for me, it will be in 2 weeks, joining you, Graham and Lupe and the rest of you for a Q&A, live Q&A after this session. So I have the honour of being able to start by talking a little bit about unconscious bias and just introducing the conversation by explaining what bias is, how it impacts our perception of ourselves, our interpersonal reactions with other people, how we interpret people's behaviour and how we judge them, and how we set up structures within the health and other systems that advantage or disadvantage certain populations. I wanted to start by reading this statement, which was written by a senior surgeon in Australia in response to the Carolyn Tan sexual harassment case from a few years ago. And the surgeon says, "As a senior surgeon now, I can definitively state that my gender has not only influenced my career, but in fact has defined it. It was defined when I was denied operating sessions by my unit head because my colleague had a wife and child to support. It's defined in the quick 'my dear' here and the comment about quotas and tokenism there. It's relentless and it's real. And just because my unit head smiles as he notes that my boots make me look like a dominatrix does not render it any less humiliating. Hear me when I tell you that after 20 years of living every day within this hamster wheel, I'm utterly exhausted." And when I first read this, I really interpreted it as a call to do better. For me, this was not the kind of workforce that I wanted my female medical students to graduate into. And I think 2020 has just continued to give us reminder after reminder that we do need to do better. Whether that's been, for example, in the US and Europe, the differential impact that COVID is having on Black populations and populations of colour. Only this week, we've had the really horrific death of Joyce Ishkawan in a hospital in Canada. And so there's lots of reminders that the health system, in my view, does suffer from systemic racism and that sexism is pervasive within the workforce. And I'm going to talk to you a bit today about unconscious bias and how it can make it difficult to achieve some of the conscious equity goals we've set for ourselves. But just because it's difficult and time consuming doesn't mean it's something we don't need to do. So I hope today to be able to set up for you and explain to you why we have bias, how it works, and to give you some realistic goals about what we can do to address it. So a few of my key points that I guess I'd like you to take away is really focusing on the fact, and this seems really obvious when I say it, but I think we often don't think about it in these terms, is that we experience the world in a physical body, particularly those of us that sort of operate in quite kind of intellectual spheres. I think we can tend to downplay this, but the research in social science is so powerful because it explains and shows that we treat people differently depending on their gender, depending on their weight, their height, how low their voice is, and certainly their ethnicity. That also means that when we experience the world, we're experiencing it through a particular lens. And I think this should make us quite wary and skeptical of the idea of meritocracy. So most of the research, and I'm going to share that with you, some of that with you today, suggests that we're not appointing people based solely on their talent and their competence and their potential. People come in physical packages, and when we employ or promote people, we are treating them as that full package. And that includes all of the biases and stereotypes that might influence our judgment based on their physical body. The next point I think I'd like you to take away is the idea that you can't learn a new language in an hour. So I think people often get frustrated that they've done these sessions on unconscious bias and they're consciously very committed to equity goals, and it can be really frustrating that things are so slow to change. So I think what you need to understand is that bias essentially operates like an internal mental architecture that helps you interpret the world. And that kind of mental scaffolding, for in my case, for example, has built up over 41 years of experience in the world. So an hour session isn't necessarily going to change that. Also, sessions like this really engage our conscious minds in discussion and reflection, but our unconscious bias is essentially built by experience. And so in some ways, they're operating on two different levels. I like to think about the project of becoming anti-racist, for example, as trying to learn a new language, trying to reprogram how we think. And anyone who's tried to learn a new language in middle age will realize how slow and frustrating that process is. I think we need to be thinking about bias and bias training as really a lifelong goal for those of us that are coming to this in middle age, and acknowledging that even at the end of that point, we may not be fluent in this new language. So being realistic about expectations is important, I think. Because it's quite difficult to rewire our brains because that's slow, one of the best things we can do is try and mitigate the impact of bias in our decision making. And that basically comes down to switching from fast thinking to slow thinking in certain areas. And I'll talk about that as we go through this introductory session today. So bias, sometimes referred to as heuristics, are really automatic patterns of thoughts or shortcuts. And we have them because they're really useful. So they allow us to efficiently allocate attentional resources. You probably are not aware of how much work your brain is doing to screen out information that it thinks is irrelevant and could be distracting from the work you need to do in the day. So, for example, when you're driving down the street, you're usually not reading the number license plates of the cars that are driving around next to you. What you're paying attention to is the lights and whether they've changed color, whether a car is indicating and trying to get into your lane. And so constantly your brain is determining what's important, what is not important, filtering out information so you don't even see it, and then presenting other information in a particular way. And often this relates to kind of preconceived ideas or assumptions about the world. So bias forms through repeated exposure. It's essentially through experience. It's a pattern recognition system. It's looking at kind of the statistical chance that certain things will happen together. Children develop an intuitive sense of gravity before anyone has ever spoken to them about science or physics, largely by throwing, for example, food off the table. In the same way, when children look out into the world and see that 95% of world leaders are male, their internal mental architecture is starting to lump the ideas of maleness and leadership together. And then that creates a lens through which they see the world going forward. It's important to understand that we all share these biases, both people who are advantaged and disadvantaged by them. So it's like a type of shared language. It influences how we see ourselves as well as the way we judge other people. So for example, really interesting study in the US looked at math performance and had students at university sit a math test, which provided the baseline data. Next set of students had to fill out a demographic questionnaire at the beginning, including noting what their gender was. So female students in that context who had been primed to remember the stereotype that female students are not as proficient at math as male students, actually underperformed relative to the baseline. Third group of students weren't asked about their gender before sitting the test, but were asked about their ethnicity. Asian students, including female Asian students, who were reminded of the stereotype that Asians are particularly good at maths, outperformed in that math test. Okay, so these assumptions are internalized. They affect the way we see ourselves and they affect our behavior and the way we act and how well we do in math tests. And they also affect the way we judge other people. So bias in many areas is not problematic. It's in fact a huge evolutionary advantage. And that's why we can't just turn it off when we decide it's inconvenient. It's problematic in a particular area, which is when, as a result of conscious debate and reflection, we have decided that we are recommitting, for example, to certain progressive goals. So that might be the civil rights movement, gay marriage, gender equality in the workplace. In those areas, unconscious bias is problematic because it's essentially like a historical ball and chain that is constantly reinterpreting current events based on a now outdated mental architecture. And that's why it can be problematic in terms of undermining equity goals. So one of the first takeaways is to be quite wary of your own subjective experience. We tend to just assume that we're seeing the world just the way it is. But in fact, all of you sitting here listening to this talk will be noticing different things, will be experiencing this through your own specific lens. You'll remember different aspects of the talk afterwards. That's why social science research is really useful, because it can help collect data to demonstrate what's actually going on in the world, and to step away a bit from relying on our own subjective experience of the world. So, for example, one study in Auckland interviewed lawyers and asked whether they agreed with the statement that there was a trend for female lawyers to leave the workplace. Now, 95% of female lawyers in Auckland agreed with that statement, but only 30% of male lawyers. So that gives you an idea if these are people working next to each other, like in the same profession, in the same city, but they have quite a different perspective of the reality of the ecosystem in that workplace. Another example is the common assumption that women speak for more often than men. So women have a reputation for being chatty. There's an English proverb goes something like, just like lamb's tails, women's tongues are never still. So research shows that if you record conversations in, for example, conferences or board meetings, men do tend to dominate. Different studies, but often men will talk for 75% of the time and women for only 25% of the time. But both men and women overestimate how much speaking time women have. So again, our subjective experience of the world is filtered through these preconceived ideas around what will be happening. So in philosophy, we sometimes refer to this as epistemic humility. That means having some humility around the sources of our knowledge and our ability to know things. And given you only experience the world in one physical body, there is a man or intersex, for example, or transgender or female, and with your skin tone and so forth, you're limited in your ability to understand how other people are experiencing the workforce. Very rarely do we get to step outside our body and see things from a different perspective. And so the story of Ben and Barbara Bars is very interesting. So Ben started out life as Barbara and studied at MIT in the US, and then went on to work in neurobiology at Stanford, and reflects a lot in his work on gender bias, having experienced the world of science as a female and then as a male. One anecdote, which is quite striking, is he talks about giving a lecture for the first time as male, as Ben, and hearing a colleague walk out and say on the way out, "Wow, his work is so much better than his sister's," which just indicates the way his work was perceived when presented as Barbara's work compared to when it was presented as Ben's work. I mean, again, coming back to this idea that we should be really skeptical of the notion of meritocracy. On that point, here's a great study. So this is a study they did at Yale, and they got a group of students and said, we want you to pick out of these two candidates who is best qualified to be the next chief of police. Michael is a streetwise, a risk taker, lives alone, and has good relationships with fellow officers. Michelle is well educated, politically connected, media savvy, and has a spouse and child. So the students intuitively choose Michael and are perfectly able to come up with lots of good justifications for why his skill set is more appropriate for that kind of leadership position. But then you take a second group of students, give them the same scenario, but switch the profiles. So now Michael is well educated and politically connected, and Michelle is streetwise and a risk taker. The second set of students also think that Michael is best suited for the job of chief of police, and they come up with a totally different set of reasons regarding why his expertise positions him best for that leadership role. This is a great example of fast thinking. We know from research that if we slow down our thinking, for example, by having set evaluation criteria before we do this sort of assessment exercise, we can minimize the degree of gender bias in this case. Also, interestingly, in this study, researchers asked students a series of questions about their conscious views about gender and leadership, and found that there was no correlation between their conscious views about sexism or women's ability to lead and how biased they were in the research. Again, indicating there can be quite a big gap between what you're consciously committed to and the unconscious decisions that you make. What was interesting, though, was that self-perceived objectivity was very predictive of the degree of bias. So students who strongly agreed with these statements, my judgment in this study were based on a logical analysis of the facts, and my decision-making in this study was rational and objective, were the most biased, right? And why is that the case? It's because if you're committed to the idea that you are acting rationally and objectively and seeing things the way they are, you have no incentive to switch from fast thinking to slow thinking. If you're aware of your bias and the way it impacts and distorts your reasoning and your judgments, you can use tactics, for example, blind review, collecting data, setting a evaluation and assessment criteria to try and slow down and systematize your thinking. Now, there's a huge amount of evidence around and research around the way gender bias, for example, and race bias influences what goes on in medicine. And it influences the way patients perceive doctors, the way doctors perceive patients. For example, a lot of research around the impact of gender and race on perceptions of pain for patients. It influences the way doctors make decisions about who to send for specialist care. It influences the way doctors perceive the potential of those that they're teaching and the competence of those who are in leadership positions. So it's pervasive. I'm not going to try and talk you through all of this. I'll just take 3 examples. In part, I've chosen these because they're quite recent. There can be a tendency to hopefully think that a lot of this is historical and will just work its way out. So it's important that we keep collecting data to demonstrate that it's still a problem. So in orthopedics, for example, 61% of women were still asked illegal interview questions, for example, about children, family planning, compared to only 8% of men. Study that found that in letters of recommendation for applicants into a transplant surgery specialty, letters for male applicants were significantly more likely to contain terms such as superb, intelligent, exceptional, and the term future leader. And letters for female applicants were more likely to use communal terms like compassionate, calm, and delightful. This is just a study from last year. Female surgeons in Ontario still earn 24% less per hour while operating. Research that came out in New Zealand only last week, again in surgery, demonstrating that surgical registrars who are female have their training wheels kept on for a lot longer, whereas male registrars are given the opportunity to act and perform independently much earlier. So speaking of the pay gap, let's drill into a little bit as to what's going on here. So why, for example, do men tend to choose high-paying professions like doctor, engineer, and CEO, while women naturally go towards lower-paying careers like female doctor, female engineer, and female CEO? Part of there's 2 main drivers here. One is that men tend to be overrepresented in very high-paying fields within medicine, and women tend to be more overrepresented in fields that are seen as less prestigious with lower pay. We actually see the same thing in law, for example, the same division in terms of subspecialties within law. So this isn't unique to medicine. This is data from the US because it's a little bit easier to track down, and also the difference is more obvious. The pay gap is slightly constrained in New Zealand because of the role of the public health system. But just here, for example, take like neurosurgery, orthopedic surgery, and radiation oncology. Those 3 specialties in the US are about sort of 81 to 85% male. So you can see just massive correlation between the highest paying specialties and a high proportion of men in those areas. Whereas pediatrics, for example, which is one of the lower paid specialties, is predominantly female. So we might think that getting women into those high-paying areas is a solution. Now, this study is super fascinating. So this is looking at 50 years of employment data in the US. And what the researchers found was that actually when women moved into occupations in large numbers, those jobs began paying less, even after controlling for education, work experience, skills, race, and geography. Which suggests that part of the underlying problem is not that we don't have enough women in surgery, for example. It's that we have unconscious bias around the value of women's work And that may be driving the lower pay in fields where women predominate. So I know this is kind of depressing, but I think it gives you an idea of sort of what a slippery fish this unconscious bias is, and how sustained our efforts are going to have to be to retrain the way we think and the way we value work, for example, labor. All right, before we move on, nearly at the end, I just want to make the point, I think it's important to put it on the table, that these gender stereotypes can actually be problematic for men as well. So at the moment, we're talking mainly about the workforce, where because maleness is associated with competence and leadership, that can seem advantageous. But in life more generally, there are stereotypes about maleness that can be quite toxic and problematic. So for example, these include the idea that men are supposed to be strong and vulnerable, stoic, assertive, and take risks. Now this plays out in a range of ways. For example, higher risk-taking, higher suicide rate amongst men, a barrier to health-seeking behavior, you know who you are, and higher social isolation. So one fascinating study, which was done in the US, looked at the data of 127,000 people and found that men who were married were healthier and lived longer than men who were never married, widowed, or divorced. And this is in part because women, particularly their wives, also other partners or even just roommates, but particularly women, wives, were providing an enormous amount of emotional and psychological and social support for men, and which they weren't necessarily setting up for themselves outside of marriage. The same study did not find the same survival advantage for women. So this was certainly a kind of unidirectional relationship in that sense. Women's health was slightly better when married, but they didn't have the same survival advantage. So that gives you an idea of unconscious bias and how it works, and some of the kind of fascinating studies in this area. The main way to address unconscious bias is to try and slow down our thinking. So this is a model described by Daniel Kahneman, Nobel Prize winning economist, who described two ways we make decisions or our brains operate. System one is fast decision making. It's unconscious, automatic. We use it for making everyday decisions. For example, that feeling when you've driven home from work and you can't kind of even remember how you got here because you can do it on automatic pilot, but it can be error prone. System two is much slower. It requires conscious effort. And it's much better for making complex decisions, for example, hiring and promotion decisions. Because it requires a lot more effort, there's some research that suggests we're better off doing this in the morning, for example, rather than at the end of the day when our cognitive resources are more depleted. So most of the research around solutions for bias are focused on what we can do and what we can measure. There's limited, really quite limited research that shows that unconscious bias training, like sort of awareness raising, does anything to actually limit bias. So collecting data is enormously important because it means we can stop having circular debates about what's true in the workforce and relying on our subjective perception, and instead we can have baselines to measure what's actually happening and how much we're improving. Defining evaluation criteria in advance of assessment decisions and blind review can be really helpful. Setting goals, for example, key performance indicators, setting targets and quotas. For example, if you're putting together a panel or a presentation, or you're looking at board membership, having targets and quotas regarding representation. I am, for example, in favour of the Otago admissions policy to create a medical workforce that reflects the community they will serve. And these kind of strategies are action-oriented, they're visible and transparent, and people can be held accountable for the kind of progress we're making. It's a great website called Bias Interrupters, which gives you a range of checklists and kind of tools to help slow down your thinking in a range of areas in the workplace and help shift from that fast thinking to slow thinking. So I'll leave it at that. Hope you enjoy the sessions that are about to come, and I'm certainly looking forward to them. And I'll see you in the Q&A session.